welcome to the EM Code. I'm Dr. Vajiha, emergency physician by occupation. Join my quest in asking right questions from right people to get right answers. Our guest for today is Dr. Alaina Rajagopal. She is an emergency physician with a background in tropical diseases, paleontologist, and a fellow podcaster. I guess these are pretty cool tricks to manage wellness, and you have done it quite early in your residency, and it's a cool idea. Talking about the next topic, a sensitive topic, I'd say. Have you ever faced gender discrimination as such? How did you handle it?
Gender discrimination is something I think most women face at some point in their life. I tend to see things more in terms of microaggressions, where people may not even be aware of what they're doing or saying, but it sort of comes off as condescending in certain circumstances. So I think a lot of times, just being a woman, people don't necessarily recognize me as a physician. And that's something that's been going on for a long time for women in medicine and women in any field. So that's absolutely something I've experienced. And, I really try not to take offense to it and just say, I am your doctor. I had one particular patient who saw myself and two other female doctors, so a total of three doctors working as a team one day. And he told his nurse that he'd never seen a doctor. And so it's a little disheartening when you hear that sometimes. But I mean, I think people who come to the emergency department are not having their best day, or they wouldn't be there. They feel sick, they feel bad. And so I think it's important as a physician to also be empathetic to that, but just hope that as more women come into medicine, that we really start to see some of those stereotypes change. And I think we also need to look at how women and physicians are portrayed in the media, in film and television, and recognize that when women are portrayed in a certain way, that sort of becomes the culture. And so I think it'd be great to see a lot more strong, powerful females in roles in television and film, in medicine or other positions of power.
Has your mental health ever taken a backseat, and what would your advice be to physicians who face issues with their mental health?
I do think that particularly in emergency medicine, sometimes we do let our mental health take the backseat. I know there are many experiences I've had where I have, coded a patient and lost a patient, and then had to take a couple of seconds to mourn that loss and that patient, and then run off to go see all of the other patients that have been neglected because I've been in the room with that one patient for an hour, even longer in some cases. And that's really challenging. I think a lot of those patients are also often upset because they've been waiting so long. And, I can't say anything to them. I can't take the time to grieve that patient or really process what happened. And so I think a lot of times in emergency medicine, the expectation is just kind of you cope, you move on. It's very military-like in that sense, where it's like you have the mission and only the mission, and your personal well-being doesn't necessarily matter in the moment. And I think there's a lot of good to that. I mean, you have to be very resilient working in emergency medicine. And so I think a lot of that's really important to be able to do the job that we do on a daily basis. But I think there can also be some damage sometimes related to ignoring your own personal well-being or mental health. And sometimes you might just need to take 5 minutes. And so I think it's difficult to find the balance in that sometimes, but it's something you sort of learn and grow with the longer you work in emergency medicine. And I'm really fortunate to have a lot of really incredible colleagues. And so a lot of times we can sort of discuss those really difficult moments with each other and help each other out when somebody has a really sick patient or a couple of patients that they have to take a lot of time with. We can help each other. And so that team spirit, I think, is probably one of the most critical aspects to maintaining well-being and mental health in the emergency department.
How was your experience in the pandemic like? What were your concerns as a mother, as a resident, as an emergency physician, and somebody with a background in virology?
Yeah, the pandemic was tough. I was pregnant actually with my first child for most of the pandemic. So in March, when the US shut down, is when I found out I was expecting. And so that was really challenging as a scientist, as a mother, as a physician, because as a physician, I feel a duty to go to the hospital and do my job every day and treat patients, especially when it's a pandemic. And like I said, my PhD was in virology and public health, and I have a certificate in tropical and travel medicine from the American Society of Tropical Medicine and Hygiene. So I trained for this, infectious disease and emergency medicine are what I do. And so while I was really worried about what would happen if I got infected, I had to go to work and do the best that I could for all of my patients, for my country, for the world, because this was an unprecedented event. And just, I felt like it was so important to do that. But at the same time, it was really challenging, not knowing how SARS-CoV-2 affects pregnant women, and knowing that women with SARS and MERS, Middle Eastern Respiratory Syndrome, also had increased preterm deliveries and pregnancy complications, miscarriage, things like that. And those viruses are in the same family as SARS-CoV-2, which causes COVID. So just balancing all of those things was a really big challenge. But like I said, knew the choice about what I needed to do was always very clear. It was always, I will go to work and I will take every precaution that I can, but it was really important to me to be there and do that. And losing patients is really hard. And at the beginning, we really didn't have a good sense of how to protect our providers and also what the best treatments were for COVID patients. And it was challenging to balance those things and figure out as a physician what risks make sense in order to treat patients, and what medications make sense to try, and going through all of that. But ultimately, we really just wanted to do what was best for patients and best for clinicians. And so that's what we did. Being pregnant in the emergency department certainly presents its challenges. I think I had a pretty easy pregnancy. I definitely was nauseous a lot. And you just kind of get through it. It's kind of that emergency medicine expectation. You just keep going, you do what you can. So I had a lot of nausea. And then as you get bigger, it's hard to kind of run around the emergency department at a fast pace. But I even had one of my colleagues say, like, wow, you're still really quick, when I was like 8.5 months pregnant or something like that. So I definitely didn't slow down too much, and still was able to do the job well. I think for maybe things like joint reductions, it got a little more challenging. I remember I had a hip that I called ortho for because I just, at 8 months pregnant, couldn't get up on a bed to reduce somebody's hip. But beyond that, I think most things in the job, talking to patients, are pretty easy to do. But some of the procedures, other providers, I asked to step in and help me out when I was a little too big to do them anymore.
Oh my god, that was a very brave call that you've taken. Not everybody walks into the front line to do so many things with a pregnancy. Oh my god, hats off to you for that. People are hesitant to join emergency medicine after a certain period of time. So, since you have joined emergency medicine relatively late, so did you feel any differences when compared to people who joined at regular time? So, being relatively older than a fellow resident, did it make any difference in your residency?
Yeah, I did get into emergency medicine quite a bit later than the average provider. Most people go straight out of undergrad in the US. So start medical school around age like 21, 22, and then you graduate around maybe 26, 27, and then go to residency after that. And so for me, I did 4 years of a PhD before I went to medical school. And it definitely presents its challenges because during the admissions process to medical school, they often want to know, well, why are you switching? What's your reasoning? And so I think as long as you're clear about your goals and why you want to do something, people are willing to support that. But otherwise, I mean, besides just being older, being more tired, I don't think that being older really changed my trajectory in emergency medicine much. In some sense, I almost feel like it was helpful in that I had a little extra life experience that I could bring to treating patients and a little more scientific background as well.
That's a pretty fantastic advice for emergency residents. And do you have any special advice for people who want to get matched into emergency medicine residency in the United States?
Um, Emergency medicine is pretty competitive, so matching can be tough for immigrants as well as for US nationals. So I think the year before I matched into emergency medicine, there were no open spots. So people couldn't even scramble into emergency medicine. If you didn't match, you just didn't match into emergency medicine. So it's super competitive and it's becoming more competitive. It's a great field, it's a great specialty. I think a lot of people enjoy shift work and never being on call, and just sort of the flexibility of being an emergency medicine physician is great. Um, but I mean, I think you just have to do the same things anybody has to do to get into a competitive specialty in that, work hard, study hard, do well on your rotations, especially in emergency medicine. You have to pay attention in every rotation and do well in every rotation because you're going to still be practicing all of those different specialties in emergency medicine. And I always encourage people to pursue extracurricular activities that are of interest to them. With emergency medicine, I think there's so much out there with like wilderness and ultrasound and hyperbaric medicine, altitude medicine. There's just a ton of really cool fellowships you can do from emergency medicine. So you can dive into one of those areas even as a medical student. And so then you're bringing that to the residency and saying, I'm really interested in these fields. And that's something that can be appealing at certain residency programs. And then I sought out opportunities to shadow in other emergency departments besides my medical school department, and I think that's valuable. I also sought out opportunities to work with other medical students on medical student boards, the Emergency Medicine Residents Association, things like that, the Texas Medical Student Association. So there's a lot of opportunities out there to network and to get to know a specialty really well, so that when you have those residency interviews, you can very clearly say, this is why I want to go into emergency medicine. This is what I think I bring to emergency medicine. These are skill sets I've developed that can help me. And so I think that helps you no matter what country you live in or where you're coming from. I guess I wouldn't necessarily recommend anybody do anything differently. For me, it worked out, but I think everybody has to do what works for them. So what worked for me might not work for another person. So I would, again, like I said, really encourage people to pursue things that are interesting to them. You absolutely have to find your niche and find something that you're going to be passionate about, because going into emergency medicine, going into medicine in general, it's really, really hard. It's hard work. Residency is tough. You work long hours, you don't get sleep, you miss weekends, you miss holidays, you miss milestones and time with your family. And so I think you really have to love what you do to be able to excel during those times and tolerate all of that. So I just say find something you're passionate about and something you love, and that'll go a long way to getting you where you want to go.
Thank you so much, Dr. Alaina Rajagopal. Thank you so much for joining EM Core. It was pleasure having you here. Thank you so much for sharing your wonderful, curious experiences with us. Thanks again.
All right. Thank you so much for having me. It was great talking to you.